Hey everyone, Dr.Mungli here. So, in this video I will be explaining you one of my YouTube community questions, which I started to post some like USMLE type questions in my YouTube community, just for the my channel viewers can actually participate in that answering that question, and also I give out the answer a day later. So, and one of my YouTube channel audience or the subscriber, I would say, so has asked me if I can make a video on that, answering the question. So this is the I'm just trying to help you out in that. So this video is to answer the question about one of the question that I have asked one day before. So let me jump into that. So here is my YouTube channel page. If you haven't subscribed to this channel, so kindly subscribe and also click that bell icon to get regular notification. So I'll be making regular videos and also posting some questions, so watch out for that. So previously I like yesterday I made a question on urea cycle. I made a video here. As you can see, there is a video here, so let me pull that out here. So here is the channel. So my channel here, Dr. Mungli's biochemistry review videos. And then this is the video explaining one of the questions. This is the question. It was a little bit complicated. And then today, what the video that I am making here is for this question, which is let me read out that question for you, enlarge it here. So here is the question. So for I am not quite sure whether you can read this. So let me read it out for you. A 28-year-old African American man visits emergency department with the complaints of severe pain in his right upper quadrant. He also complains that the pain radiates to his right shoulder. His past history is significant for repeated episodes of severe bone pains, hemolytic crisis, especially upon exertion. Ultrasonography of his abdomen reveals a stone in his gallbladder, which is significantly impacting his cystic duct. Which one of the following is most likely a primary composition of stone? Okay. So the choices is cholesterol, monosodium urate, calcium oxalate, calcium bilirubinate, and calcium phosphate. These are the options, right? So as you look into this case stem, so is a 28-year-old African American man. So there is something in that, like African American, or like all this epidemiology, the freak population genetics and all that. You got to keep that in mind. Certain diseases are specifically present in certain population. So, and the patient complains of severe pain in his right upper quadrant. Always remember, the right upper quadrant pain is usually indicative of something to do with the liver. Okay, so let's be with there. He complains that the pain radiates to his right shoulder. So the radiation, so there is a pain which is radiating from the upper quadrant to the right shoulder. So in that sense, you got to remember about when the radiation of the pain is there. So usually the gallbladder related issues, so radiate to the right shoulder there. So his past history is significant for repeated episodes of severe bone pain, hemolytic crisis, especially upon exertion. So hemolytic crisis upon exertion, usually this you can see in sickle cell anemia, sickle cell crisis. So and also you can see African American man, right upper quadrant pain radiating to the right shoulder, and hemolytic crisis upon exertion. So and as you can see, like gallbladder is enlarged and it is having a stone, like ultrasonography's abdomen reveals stone in the gallbladder, which is significantly impacting his cystic duct. So all this is basically a sickle cell anemia patient, repeated sickle cell crisis, hemolysis is going on. So as the hemolysis goes on, that means the hemoglobin which is coming out of the red blood cells, so it will be broken down into heme and bilirubin. And this because hemoglobin is carried to the liver by a haptoglobin molecule, and hemoglobin breaks into heme and globin, and the heme is further converted into bilirubin, and this there will be increase in the concentration of bilirubin. So basically bilirubin is made in the liver by breaking down heme by heme oxygenase enzyme, and this bilirubin, which is unconjugated, can be conjugated by UGT1A1 enzyme, and this bilirubin will be carried to the gallbladder and it is stored there, right. So, if the gallbladder do not contract properly, or even the calcium is sufficiently available, something like that, this bilirubin can precipitate with the calcium and become calcium bilirubinate pigmented stones. Okay. And the answer, so the question is, which one of the following is most likely primary composition of the stone? So, the answer is calcium bilirubinate. That is what 73% of my YouTube audience has selected, and that is the correct answer. Okay. Other choices like cholesterol. Cholesterol stones are commonly seen in people who eat high carbohydrate diet, and also it is commonly seen in female and who is obese and aged around 40 years of age. So, we simply put it as fatty female at 40, right. So, that is cholesterol. Cholesterol stones almost they are not pigmented stones. So, monosodium urate is actually, it is the monosodium urate crystal which you are going to find in the joint space, especially this is seen in gout, in patients having gout. So, they will have monosodium urate crystals, that is the composition. Calcium oxalate stones are seen in primary oxaluria, or if there is excess consumption of green leafy vegetables, and if they too much of green leafy for that matter, and if they have any issues with the catabolism of oxalate, glyoxalate. So, the calcium oxalate stones are possible, and it is generally seen in primary oxaluria. Calcium phosphate stones are generally seen in people who are having overdose of vitamin D, or maybe having some issues with the renal tubular acidosis, things like that. So, these people might have calcium phosphate stones. So, here for this particular question, so the answer is calcium bilirubinate, because the calcium bilirubinate is the composition that is present in people who are having sickle cell anemia, or any hemolytic anemias for that matter. So, hemolytic anemias where the bilirubin is increased because of the heme is broken down into bilirubin, and hemolysis means, so there is a release of hemoglobin, and heme is further broken down into bilirubin, bilirubin levels increases. So, that can give rise to calcium bilirubinate stones in the gallbladder. So, not just sickle cell anemia, any hemolytic anemia, when there is a increased frequency of hemolysis is seen, you do expect calcium bilirubinate stones in them. Okay. So, this is all about my question. So, I will see you in my next video. Till then, you take care.